experts are debating the pros and cons of a proposal to lower the diagnostic threshold for gestational diabetes. Dr. Albert Reese, a noted expert in this area, sat down with us to share his views.
I think the recommendation of the so-called IADPSG, that's the International Association of Diabetes and Pregnancy Study Group, is which recommends that there should be a screening of all patients, which is fine, but more importantly, lowering the threshold. Okay, that's the key point, lowering the diagnostic threshold. And secondly, using a one-step approach, a one-test approach, is maybe considered to be hasty. So it's a controversy right now as I like to say, whether to change or not to change. That really is the question.
If the diagnostic criteria are changed to include these women, it's projected to increase the number of gestational diabetes diagnoses by threefold. You're talking about many, many more cesarean sections. They come with their own load of problems.
It is quite possible that the incidence could go from an average rate of about 7% to over 20%. And as you said, with the related complications from more cesarean sections and potential infections from cesarean section, and not to mention potential liability that often is, unfortunately, is sometimes associated with obstetrical care. So there are a number of adverse consequences that could result from this increase. It's not just simply diagnosing a condition earlier, but rather diagnosing earlier, having the incidence much higher, with a potential for increased complications and potential liability as well. If we were certain, or at least had a high level of certainty, that making the diagnosis early through this means would actually improve the outcome, then I think it would be a very compelling reason not to change. At this point, where many are unconvinced that actually a change would actually result in improved outcome.
From the University of Maryland School of Medicine, I'm Michelle Sullivan.